Hello, everybody. I'm Gordon McVie, and I'm a professor of cancer medicine, but I'm also a cancer patient. And being a patient doesn't half give you a different view on life, and that has already changed several of my attitudes with respect to delivering information to other cancer patients for whom I'm responsible. So being a cancer doctor and being a cancer patient, you might think that gives me a fast track. Well, I can assure you it doesn't. I've got prostate cancer, and the good news for me and for everybody else, and there are thousands of people in the male world who've got prostate cancer. The good news is that we've got on top of it. We haven't had a good screening test to compare with mammography or cervix screening for women, but we now are close to getting better ways of finding out whether the trouble you're having with passing water at night or just pain in the pelvis is really due to cancer of the prostate or not. The treatment for cancer of the prostate is changed radically over the last 50 years since I was a medical graduate in Edinburgh. Surgery is now remarkably different from a 4 or 5 hour operation with 2 liters of blood lost to 2 or 3 hours with 2 teaspoonfuls of blood loss. And this is thanks to the way that you can do everything now through telescopes. You put lots of 4 or 5 telescopes into the belly and you can do operations that way. You don't need to do massive grid operations to remove everything in the bottom of your pelvis. Radiotherapy, much better than it used to be. Used to be that the radiation hurt all the normal tissues around the prostate, and they're very important tissues like bladder and bowel, and you could get lots of side effects from those. But now we've got radiotherapy beams are a bit like Exocet missiles. They really are targeted, and that means that you can have a treatment which lasts quite a long time. It's you get daily treatment for several weeks, but you do not get the same sorts of problems with the bowel and the bladder. You can sometimes get some irritation with both of them, but it's nothing like it used to be even 10, 15 years ago. That's really good news too. And then the third thing that's improved, and this is my specialty, and this is new drugs and new medicines for all kinds of cancer. New medicines for prostate cancer have just burst open. I don't think there was one that I could think of except hormone therapy 10 years ago. And now we've got, I suppose, 10 new drugs. Half of them at least have been registered for the Americas and for Europe and for Asia. And these are really active medicines. And they're not necessarily the kind of things you associate with chemotherapy, the drugs falling out, the hair falling out, being sick, and all the side effects. And many of these drugs are antibodies. And antibodies give you far fewer side effects. And they really seem to be active. And we're thinking about the way we give these drugs now, these medicines. Maybe sometimes before we do an operation or before we give radiotherapy or sometimes with radiotherapy. All these things have happened. And what's the good news is that prostate cancer deaths are going down. This is really important because, of course, prostate cancer occurs in older men. I'm 75. And older men have got other problems associated with old age, like heart attacks, like neurological problems, like metabolic things like diabetes. And prostate cancer is now so well under control that actually it's not the big killer it used to be 10 or 15 years ago. And people are living longer and happier lives. So that's my message about prostate cancer. My message about all other cancers is it's high time patients got more information about their own illness in words that they understand. It's high time that the patients knew that all the information that hospitals got is their own data. It belongs to them, and the hospital cannot keep them away from you. It's high time that patients had the courage and the equipment, which eCancer Patient provides them, to ask questions of the doctor, to communicate, to discuss, so that at the end of the day, what we call personalized medicine, the patient and the doctor decide together what is going to be best, because every patient is different. Thanks very much and good luck.